Okay, we will study about SAS. SAS mean in medical term is called acute coronary syndrome. Acute coronary syndrome. Acute mean it occur within hours to 3 or 4 days. Coronary means coronary artery because it disturb the blood supply of the heart vessel that supply the heart. We call it coronary artery and syndrome. That the definitions. Okay, and then we go to the types. It has 3 types: unstable angina, and STEMI. And STEMI means non-ST elevations myocardial infarctions. Okay, I will explain in a minute. And also STEMI. Okay, STEMI is ST elevation MI. So what differentiate between these three is based on the ECG and also biomarker. Mean the enzyme of the heart muscle. Okay, and then unstable angina, the ECG is normal. Maybe unstable angina. ECG and biomarker normal. Okay, the STEMI is ECG is abnormal. From the word STEMI, ST mean ST elevation. So the ECG is normal, but there is a abnormal biomarker. STEMI both abnormal and abnormal. Okay, so ST elevations and also abnormal in biomarker. This like table here. Okay, and then we go to the risk factor. Actually, risk factor associated with the common underlying like hypertension, diabetes mellitus, and also dyslipidemia. Management, how to manage is depend on the type of these three. General measure, back then we use mnemonic MONA. MONA means morphine, because usually patients presented with chest pain, chest pain. Retrosternal, radiated to jaw and left arm. Jaw and left arm. This is a referred pain lah. And then we go to the management. Mona means morphine. We address the pain. O for oxygens. N for nitrate. Nitrate is used for vasodilatation because there is a blockage in the blood flow. So we use nitrate to allow the blood to flow. A aspirin is a anticoagulant. Okay, we use this one. Management general measure. Antithrombolytic, like antiplatelet, anticoagulant, antiplatelet like this one, like clopidogrel and atorvastatin. Anticoagulant like aspirin or fondaparinux. Okay. Beta blocker used for reduce the heart rate. It reduce the workload of heart, because when heart working more, so it needs more energy, more oxygen, so decrease the work will decrease need of oxygen. So we saw, but it has some concern regarding the contraindications. Must be put in considerations, the contraindication of beta blocker. Nitrate, as I mentioned, vasodilated. GTN, this one we put what we call it sublingual GTN. Okay, and then calcium channel blocker, the same, not the same but the same mechanism. Calcium channel blocker. Okay, statin atau vastatin is a antiplatelet. We also can reduce the ACE. We use ACE or ARB, means angiotensin ACE inhibitor, angiorenal, something that cause vasodilatation so decrease the peripheral resistance to make the heart more easier to work. We try to correct the any underlying cause like hypertension, NDM, and also dyslipidemia. Try to correct them. And also, if all these things, the medications doesn't resolve the pain, and also the what we call it, the pain, and also the biomarker and ECG, we can proceed with invasive like PCI, percutaneous percutaneous, and then lastly just that monitor lah. Okay, acute coronary syndrome occur within hours. Coronary mean coronary artery, and also syndrome. Definition type, it has unstable, STEMI, unstable. It depend on ECG biomarker. So unstable and STEMI risk factor.